remote speakers, Florence Riako Anam and Bongilan Kos from the Global Network of People Living with HIV. You bring the voices of the communities, of the people who are at the center of the AIDS response. Please share with us the perspective of people living with HIV on the current stage of the AIDS response and any key messages that you would like to impart with the other stakeholders in the room.
It's an honor to speak in this panel. I want to start by talking about a meeting we held recently, hosted in Kenya by the National Empowerment Network of People Living with HIV, NEFAC. GNP Plus brought together over 80 people from 18 countries and 6 regions of East and Southern Africa, LAC, MENA, ICA, West and Central Africa. In this meeting, we were not alone. We were joined by government representatives, healthcare workers, donors, epidemiologists, researchers, UNAIDS and all its co-sponsors, every partner that works within the HIV movement, including the media, were there with us. We released the report of this meeting this week, and I will use my 5 minutes to share with you one concern that came out of that meeting, one lesson, one need, and a commitment. The bold concern was our access to treatment. For many of us, the week of January 20th erased completely the certainty of our access to treatment in a way that we know it. For many, tested in different years of our lives, one thing has always been true. We knew we had our treatment. But now, that remains uncertain. The way we received it was also how we have worked our lives around it. For many of us, multi-month dispensing, going to the facility 2 or 3 times a year, getting our viral load test, and that is now all gone. The lesson, because we listened to particularly government representatives and health providers talk to us about the reality of our HIV programs at country level and how our services have been vertically funded, the practical realities of how this was not going to be sustainable was clear to all of us, and for many, welcomed. The need identified. Integration of HIV services into primary healthcare emerged as a way to ensure all of us access person-centered care. It was not because of the funding we agreed, but because we need it. As we evolve as people living with HIV, with many of us aging, this proved to be essential. The resolve and the commitment. We people living with HIV networks resolved and committed to work together to build trust with our governments, who we believe we will have to work together with strategically to ensure all of us, people living with HIV, have access to treatment. Allow me to make 2 asks and an offer, and I'll be very quick. I do understand the frame and the narrative of what is at stake and what the cost of inaction will be. In the midst of adapting to the change that affects all of us, we now have to contend with an repeated narrative of our diagnosis being death. I would like to invite you all to zoom in and meet us where we are with our governments, working, mapping, organizing real-time solutions. People are concerned about number of clinic visits, not getting the package of treatment they are used to. We have to repeat our viral loads for those of us who did them in January because that data is gone, and the anxiety of all this uncertainty. We can figure out the current real-time problems, even as we take stock of what could be if we don't do different. Because we know where the shoe pinches hardest, we are quickly moving to organize ourselves to fix the shoe where it pinches. We wonder, however, if the adaptive and reimagined policy and programs are moving at our pace. And it is because of what Anjali said just now. We are not sitting with you. 1 or 2 of us may make it into your processes, particularly as you define critical and essential. We have not had a moment to define our own critical and essential. We define it, we are organizing, we are thinking ahead with what we've got, not to keep all of us on treatment. Which leads me to the ask as I close. We are here with an infrastructure that complements all our work in HIV, built by you all, governments, donors, partners. The win for the HIV response has significantly been complemented by the high-impact community-led and based interventions. We are an infrastructure that can serve the primary healthcare users. We are at an opportune time, backed by incredible progress in science that affirms undetectable equals untransmittable, underscoring the high impact of HIV treatment, not only to securing our healthy lives as people living with HIV, but also for HIV prevention. We have many people living with HIV committed to a mind shift to embody self-care and work with you all to realize the ambition of HIV epidemic control. I thank you.